I was in 8th grade. I knew I wanted to be a psychologist. My reasoning in my 8th grade mind was to help people. I had a lot of friends that were going through a lot of stuff at the time. I enjoyed the fact that I could be there for them and create that safe space.
Clinical psychologist is an individual who obtained a PhD in clinical or counseling psychology and then completed an APA-accredited internship, which is a year-long full-time work.
This profession is about always staying curious. There's always new approaches to therapy. There's always new research. And so continuing education is very important.
One of the differences between a licensed clinical psychologist and maybe a master's level counselor would be that psychologists can provide assessments to individuals to look at different diagnoses and then to provide similar services. There's a lot of really creative uses for a clinical psychologist. You can work as a private practitioner. You also can work in a VA, so the Veterans Administration. Universities are really popular places for clinical psychologists, and then within hospitals or other healthcare settings.
I'm a contractor in a private practice, so I'm able to just adjust my schedule based on what I need, because I think that I would get burnt out if I did the same day every day.
I would say that no matter where you work, there's two main features that psychologists really focus on. And one is training new professionals, so whether that be medical students or psychologists in training, and then also providing clinical services. Prescription rights are state by state. The state of Illinois added prescribing rights for clinical psychologists. And so what that means is that as a licensed clinical psychologist with additional training and supervision and an additional license, then you can prescribe medication. I think people that have really strong empathy skills are very good at being a psychologist, but unfortunately that also, sometimes when you're really empathetic, that also means that you carry around the weight of other people's emotions and other people's experiences. The things that I have done that I think keep me well and keep me successful in this field is that I found really good outlets. Really it is, finding in a training environment that you have the support and the guidance on how do I do this in a way that I can still live my life and be productive and be happy and healthy myself.
I'm automatically creating a safe space for people that are part of my community. So I think that's what's been beautiful, is that I am being able to be there for them.
When somebody is working through their mental health challenges, they really start to become better parents, better family members, better community members, better at their job. And so it really ultimately isn't just the individual that you're changing, it really is the full community that you're having an impact on, which is pretty darn cool.